Hi, and welcome to this week's episode of Ask Dr. Jessica. This week we have a very special guest, Elisa Hirsch. She's a certified lactation consultant and personal friend, and I'm excited to share with you her tips about breastfeeding. Elisa, thank you so much for being here. I thought I'd start off by asking some basic questions to help moms navigate through breastfeeding. So first, if a mom is pregnant, do you think there's anything that she can do to prepare to be a successful breastfeeder? Do you have any advice on that?
That's actually a very good question and a common question. So first thing I would say is if she can, attend a breastfeeding class taught by a board-certified consultant. She'll get a lot of good information by attending that class. That's first
Maybe
thing.
like a month before the due date, or how much in advance?
You know what? That's also very interesting. I've had moms come the minute they've conceived because they were so excited to attend. They didn't look pregnant. They were pregnant. They knew it. They were excited. They wanted to be there. And I've had other moms attend a class a week before delivery and wish they had come sooner. So whenever they're ready, whenever they're thinking that they'd like to have this information, that's the time. The sooner the better, then they can sort out and have questions answered.
And be more confident, I think, after delivery, right?
Absolutely.
The more knowledge, the better. Okay.
It's huge. And then too, for them, when they're pregnant, they can also find healthcare providers, I have to say, like yourself, that are very supportive of their wanting to breastfeed, because it's normal to want to breastfeed. It's normal. And they need to be with professionals that will guide them and help them achieve that.
I agree with that. I agree. And after a mom delivers, so after she does have her baby, when can she expect to see breast milk?
Breast milk is actually made when she's pregnant. The first milk is made when she's pregnant. And that's why a lot of times moms in latter months of pregnancy will say, oh, I saw some discharge coming out of my breast, and that's the milk. And the colostrum is actually there towards the end of pregnancy. But again, early pregnancy, the milk is there. If a mom were to deliver prematurely, then that milk is there for a preemie. It's prepared, ready to go, and exactly what a preemie needs. So it's there early on.
Now, what about, I have a lot of moms after they deliver, and the babies commonly, and we expect that they're going to lose weight in the first couple of days. So one thing I like to point out to moms is that colostrum that comes in is helpful, but you won't see the babies gain weight, until maybe 72 hours after delivery. What do you think about that?
Sometimes it's even longer because now a lot of moms have IVs in labor. And there's some question about the baby's actual birth weight, if that would have been what the baby's weight would have been naturally if the mom had not had any additional fluid in labor. So you might see a greater loss than you would see otherwise. It would make the mom think, something isn't going right. But the baby, if allowed to nurse without any pacifiers, and the frequency that the baby needs, will help the volume come in very quickly if the mom allows the baby access to the breast.
I've read that, we always talk about how babies shouldn't lose more than 10% of their birth weight, that once they go below 10%, a lot of doctors will start talking about introducing formula. But I've read other articles that say, to your point, it's better to wait 24 hours and then from that 24-hour wait, then think about the 10% loss, because a lot of that weight loss in the first 24 hours is fluid. So to your point about the IV fluids, I think that's a good point, because we often rush babies to trying formula when they, that we're scared they're losing too much when really they're doing okay.
They're doing okay. A lot of things. Yeah. If you factor in the fact that the fontanelles, you look for all the signs of dehydration, on exam. And if the baby is checking out fine, and then you anatomically check the mom, check the baby. And if that's fine, then you look at the latch and the suck and the swallow. And if that seems okay, then it's all pointing to perhaps weight loss as a result of the fluid. You carry on. But if anywhere along the path there's something different, then you intervene if you need to.
Now, what about babies that have trouble latching in the beginning? Do you have any tips on how to get babies to latch better?
So again, that's a common question. A lot of it depends upon why the baby isn't latching. If the baby is, let's just say, a few days out, jaundice, baby's going to be sleepy. If the baby had a lengthy labor with mom, baby may be tired. If there were any use of any intervention during labor, the baby may be sleepy. A long labor followed by a C-section, a vacuum, these types of interventions might make for a sleepy baby. So the baby wouldn't be feeding as often as it would be had there not been any intervention. So instead, keep the baby skin to skin, rooming in, no passies, no bottles, and just give the baby a chance to wake up. The more skin to skin access at the breast, the better. Because it's amazing to me that the fragrance around the areola is similar to that of amniotic fluid. So babies actually know where they are if they're given the chance to be there.
That's really interesting. So it's more skin to skin.
Yeah, a lot.
I'll tell parents to do things to wake them up. And maybe this is not good advice, but I'll advise to do the opposite of what they would do to help the baby go to sleep. Like turn a lot of lights on in the room, make sure the baby's undressed, tickle their feet, tickle under their neck, try to do things of that nature to wake them up a little bit to latch. But maybe I think skin to skin is a good tip that I don't probably advise enough.
And you can always try those other things too. There's no harm in them. And if they work, then great. No harm.
Right. And sometimes I'll tell parents or the mothers to try to express a little bit of milk to see if that'll get the baby interested. Hand express.
Sure. A good idea. Sometimes some moms can't hand express effectively. And so what happens is they try and hand express and they're convinced because they're not performing it the right way that they have no milk. But if you show them how to do it, then they see it and it's amazing. It's almost like a big light goes on and they're animated and oh my gosh, it's there. It's very exciting.
There's milk.
There's milk. And then they believe, that it's really there because you can't see it.
It's true. It's a technique to learn how to hand express.
It is.
Yes.
It is.
Okay, that's great. And what about a common thing that happens that I actually experienced myself with breastfeeding, nipple pain? Do you have any advice to help moms? Because I know some degree of nipple pain is normal, especially in those first couple of weeks. But any advice on how to get moms through that difficult period?
You're absolutely right that a certain degree of nipple pain is normal because we're not used to having a baby suck at our breasts. And so what happens is nipples are erectile tissue and it takes just, a minute or so for the nipple tissue to extend to the back of the baby's palate. And so that initial, oh my goodness, it can be pretty intense. And so after several days, that should go away. What I normally do is ask, when does the pain happen in relation to a feeding? What does your nipple look like coming out of the baby's mouth? And it should be long and round. If it's misshapen in any way, then that is a clue to the origin of the pain. And it always helps to have them change position with every feeding.
Okay. So you mean like cross cradle or football hold?
Yeah, because absolutely, whichever way the baby is facing is going to put different pressure on the breast.
Okay.
So if we can say that the nipple's long and round coming out of the baby's mouth and the mom nurses in football or cross cradle or side lying, any of these are going to change the pressure. If she has any kind of redness, cracking, bleeding, then it's cause for help.
Okay. What about using a nipple shield in those circumstances? I've heard mixed reviews from lactation consultants about whether or not to use a nipple shield, if that's, harmful because maybe it'll decrease the amount of milk supply. Is there a time and a place for a nipple shield?
Well, yes, there's a time and a place. In my practice, I would not advise using a nipple shield unless that baby and mom, the couplet, were assessed prior to using the shield. Because when a couplet uses a shield, the amount of stimulation to the breast is diminished, and the amount of milk flow to the baby is often diminished too.
Okay.
And so if it's the early days and they're trying to establish volume, it's easier to figure out why things aren't working than to try and put a little Band-Aid on it and develop a bigger problem for later.
I see. So it's more of a Band-Aid rather than the solution.
Yeah. It's always easier to let's find out why you're sore and then fix it. And then you don't need the shield because the shield itself can bring other problems too.
I often find too that the first couple of minutes of nursing tend to be the most painful and uncomfortable. And if you can sort of wait through that first minute or two, do some deep breaths, kind of take your time through those first couple of minutes, then it tends to be a little bit easier afterwards.
Absolutely. Look at the baby. Try and distract yourself from what you're feeling because it can be really intense. But look at the baby and realize that this is going to pass. And it does. And then as soon as it does, you take a deep breath. Okay, fine. We carry on. The other thing sometimes, too, is to have them do switch nursing. If they're sore, nurse a little bit on one side, then go to the other, then back to the first, back to the second, because that reduces pressure. But pain that goes with any kind of redness, cracking, bleeding is not normal, and that should be evaluated. The initial pain is normal, but the rest of it is not normal.
Okay. How about, so to set up a mom to be a successful breastfeeder, how often do you think she needs to breastfeed to establish enough of a milk supply? I know we always say every 2 to 3 hours. Is that what you would say? I mean, I think what I notice is parents have trouble. Do they have to be very routine and rigid, or can we follow the baby's lead? What's your advice on that?
Parents, most parents want a job. They want to do it right. They don't want to mess up. This is their baby. They want to get it right. So I've often been known to say, if you can do it, keep the baby, as we said before, skin to skin as much as you can. Anytime you see that baby's hands go into the mouth, anytime you see them rooting, anytime you start to see the little REM movements under their lids, put them near the breast. Put them on. You can't overfeed them. And in the beginning days, they can't tell time. The babies can't tell time. And in the beginning days, the more that they're able to feed, the more access they have to the restaurant, the more milk that's going to be served.
Right. Yeah, I'll often say to parents that they are the baby's restaurant that's open 24/7.
Exactly.
When the baby's ready to feed, they should be ready to serve the meal.
Exactly.
And then you can't go wrong.
Can't make a mistake. And I saw years back a little baby that had a T-shirt on. It said, "I eat at Mom's," and I thought that was the cutest thing. It's so cute because it's exactly what you're saying.
I have a lot of moms that will say to me, or parents, they'll say they are nervous to breastfeed because they can't see the quantity the baby's getting. They like the bottle because they can actually measure out, this bottle has 3 ounces in it, and they want to visually see the quantity the baby's getting. Do you have any tips to make moms feel better?
Well,
they can actually visually see the quantity.
That's so hard. If somebody was visually watching everything I put in my mouth, I would really be embarrassed because who's going to count?
Me too.
You know what I mean? You don't need to do that. The baby will stop when they've had enough, and they'll start when they need to eat. And just as one trusts that pregnancy will go well, one trusts that the body knows how to do this. And it's one of those, if you're counting the diapers and the diapers are there and the baby's satisfied after feeding and you hear swallows, then you know they're getting. But there's that element of control that sometimes, no matter what, this is what they're going to do.
Yes. No, and I think it's true. You have. Go ahead. What
I would say trust the baby to know.
Right. And it's true. I think it takes some time to get confidence that when the baby's feeding, you can see the suck swallow. You can see that they appear satisfied after a feed. You're right. You see that you count the wet, dirty diapers. Mm-hmm. Yes.
Oh, yeah, absolutely. Yes. And then when they spit up a little bit on you, it's going in, it's coming out.
You see the milk in the corner of their mouth.
Yeah, yes. Absolutely.
Now, what if they go to the pediatrician and they get the baby's weight checked and they're not gaining enough weight? Do you have any tips on how moms can make more milk?
How to make more milk? Well, first thing, if the baby's not gaining more weight, I would want to know what's going on during the feeding. So I would say consider an evaluation with a consultant. That's first thing.
Oh, yes.
As important as that is, the other part of it is the mom's, what does her anatomy look like? A lot of times I've worked with moms who didn't realize that the baby wasn't getting any milk. They never nursed before. They didn't understand, and the baby was not latched correctly, not feeding correctly. And as soon as you correct the latch and the position, bam, things take off really, really well. So that's easy. That's an easy fix. But after that, you one would evaluate the breast, one would evaluate the palate, the tongue, one would evaluate the connection, what actually is going on. And if in fact at that point the baby is still not gaining weight, then yeah, I would implement some other measures.
Do you think that and most moms that you meet, do you find that they are able to make enough milk?
Absolutely. Getting back to making more milk, something as simple as switch nursing. If the baby's nursing on one side, switch them to the other, then put them back to the first, back to the second. It's like a double serving,
Right.
And that brings down more volume, and the baby gets more milk and increases her volume.
I often say it goes back to supply and demand. If the baby latches enough and the mother's body feels the demand, they'll react and have a corresponding supply. So the more that you breastfeed, the more milk that will be made.
That's a given. The thing that the hidden mystery sometimes is, oh, but I didn't realize that the baby couldn't have a pacifier all night. And then you find the baby's in the crib with a passy, and there's a passy on the floor. There's all these passies that every time the baby squawked a little tiny bit, someone walked in, mom or dad, and plugged the baby up, because they don't know that babies don't sleep through the night for months. And so you take a careful look at what's going on. In the beginning, until the supply is well established, I'm one to say wait 6 weeks before you introduce a passy, because give the baby a chance to be a baby.
Yes. I know we're all in such a rush to get a good night's sleep that it's definitely tricky on parents when they're exhausted and they're anxious to start getting some rest. But you're right.
It's a fine balance.
It's a balance. What about things like fenugreek and hops and those special breastfeeding cookies? Do you feel like that's of any value?
Well, the cookies are not going to hurt anything. They might be a nice snack. They're not evidence-based, but hey, if they have a good cookie, I'll try it. Cookie's a cookie. As far as fenugreek, there's not any evidence-based study to support that. I'm not one that's going to say do it. Some people will eat oatmeal because they feel oatmeal is a galactagogue. Sure, not going to hurt. It's not going to. There's no harm in it. I would rather take a look at, again, the frequency of feeding. Be sure they're feeding often enough. The switch nursing. Be sure the mom's getting enough rest. Be sure the mom herself is taking care of herself. Because it's so, a lot of women after they have a baby feel like they don't make enough milk because they can't see it, they can't measure it, they don't know that they're doing it. Maybe 1% to 2% of moms can't make enough milk, but that's everybody's concern, even in later nursing. I don't think I'm making enough. We always worry. We want to be able to feed our children.
Now, and speaking of volume and production, I do meet a lot of moms that want to start storing milk early in the refrigerator because they're going back to work and they have friends that have stored a lot of milk and they're expecting to be overproducers. But my experience is that most moms really make exactly what they need to feed the baby. It's really hard to be an overproducer. And I sort of feel bad that moms have this pressure that they're supposed to make, a lot of extra milk. What is your experience on that?
It is hard. As we were saying before, moms always wonder whether or not they're producing enough milk. Even when you look at a baby with extra rolls and bright eyes and beautiful skin and a happy smile, the mom says, I'm not sure I have enough milk. And so that is what we get.
Even with the proof in the pudding.
Yeah, looking right at this gorgeous baby, I'm not sure. How can you be not sure? I'm
Right.
sure, you know. But with respect to the volume they're producing when they're pumping, sometimes it depends on the pump they're using. If they change up to a more effective pump, they'll get more milk. But it's normal when they pump, maybe they only get a half an ounce extra. Maybe they only get an ounce and they think they're supposed to get a half a gallon. It doesn't work like that.
Right. No, I always say there's nothing better than the baby to the udder. Like a pump can never exactly be as good as the baby to the breast.
100%. 100%.
Even though I'm very grateful as a working mom, I'm very grateful for pumps.
Yeah, of course.
Because they allowed me to breastfeed.
Yeah, you did so, I have to say, you have done so well. Because it's not easy to be a physician and be a mom and maintain the volume and also get everything done that you have to get done. That's a very, very fine juggling act that you have managed to do beautifully.
Thank you. I want to tell you, when I was breastfeeding my first daughter, and I remember I saw you, and you were so encouraging and so positive. It really helps. It really helps to have positivity around new moms. That's for sure. So thank you.
And the other thing is, I mean, the thanks goes to you truly because you were determined. This was going to work. This was going to work. And it makes a difference. Surround yourself with people that are going to support you.
Yes. To give you tips and advice. It's true. Makes a big difference.
Yeah.
And then some other questions that come up. What do you think about babies sleeping at night? Do you think that we have to wake them to be successful breastfeeders, or can we let them sleep through the night? When do you advise letting babies sleep through the night?
This is also very controversial. So after the babies go back to that 2-week check for weight and wellness, if they're gaining weight and they've regained their birth weight, I'm the first one to say leave them sleep at night. Don't wake them up because they've proven they're gaining. Leave them alone.
Once they've proven they know how to gain weight, you can let them sleep through the night. I agree with that.
Of course. I mean, what are we doing?
Let them wake up on their own.
Yeah. And they will, as long as they don't have a passy in their mouth, because then they may not. But yeah, let them be a baby. Let them wake up when they need to wake up. There's no reason to wake them up.
That's all right. So what I've taken from you too is not to. So okay, I'm gathering that the passy is not your favorite until you said 6 weeks of age. Okay.
Yeah, because you want to establish that milk supply. What happens actually at 10 days of age will affect what happens at 6 weeks of age. Because the hormones, there's a correlation between that. So if they can get off to a really nice start in the beginning, that's going to ensure them a volume that's going to last for as long as they want to feed. So while passies will help the mom, it doesn't always work in the best interest of the baby early on. They're better off getting some calories than they are just soothing.
That makes sense. Now, in speaking of introducing extras, what's your thought on when to introduce pumps? Do you have any idea or thoughts for moms that have to go back to work, or if a mom wants to go, on a date with her spouse or go to the grocery store? Do you have any ideas at what time a pump is okay?
Well, sure. I have ideas about just about everything. But anyway, with regard to pumping, at 3 weeks, again, with the baby gaining well and the mom feeding often and things are as smooth as they can be for 3 weeks, it's still in the thick of the tough. It gets easier after 6 weeks. But at that point, if mom wants to pump and introduce a bottle, it's often a good idea between 3 and 4 weeks to let that baby experience milk from a bottle so that mom could go on her date night or go get her nails done or get her hair done, whatever's important to her. And she can leave with knowing that the baby is going to be okay, is going to accept the bottle, and her milk is there in the bottle. So at 3 weeks, if mom wanted to pump once a day, if that worked for her, go for it. If once a day is too often, wait. But at least give yourself time before you go back to work to get a reserve in the freezer so the baby will have food when you're away.
Yes. And if you do it too early, then you're at risk for having I've seen a lot of moms get mastitis, or they can't overproduce if the pump is introduced too early.
Well, and two, again, depending upon the type of pump, some pumps, I don't want to implicate any companies, but some pumps that are sold, they do not effectively drain the breast, and they in themselves can cause a predisposition to mastitis. So if a mom is pumping 6 and 7 times a day, that's a big problem. If she's pumping once a day, or if she wants to pump twice, I don't know how she has time to pump twice a day in the early weeks, but if she did, it would be 1 in the morning, 1 at night, so she's not putting a big stress on her body, and then gradually wean off that pump. Because if you, like you said, if you supply and demand, ask the restaurant to produce a whole bunch, and then the restaurant does, and then you say, I don't want it, and there's the order waiting for you, you're going to end up with a backup like mastitis or plugged duct.
Which is so uncomfortable.
It hurts.
It hurts. What about, I mean, I know, especially being a lactation consultant, formula is not the, not ideal. But I meet a lot of moms that feel like they have to do either one or the other. Like as soon as their milk supply starts dropping, they just sort of want to give up breastfeeding altogether and go all to formula. So I'll often talk about trying to fit in both. Do you ever recommend that, or what do you think?
Well, the baby's got to eat. So
right.
If she doesn't want to feed the baby, can't feed the baby, she better feed the baby formula.
Right, that's number one.
Number one, baby's got to eat.
Course.
And also
right.
Not a formula from Germany, a formula from here in the States that we know. Right. I don't know if you've run into that, where they bring formula in from Europe. And it's like, it's not, what are you doing? I can't.
Not FDA approved here.
No, no. It's like, put that stuff away. Talk to your pediatrician about that. I don't want to see it. Don't use that till you talk to your pediatrician. It's like, what are you thinking? But I can't say that. So right. I don't say that to them. But yeah.
So if you had to pick a formula, you recommend something that's marketed,
You know what?
In the United States.
Yeah, absolutely. Absolutely. Baby, number one rule, feed that baby. And if it's formula, so whatever. The baby's got to eat. That's
nice to hear
one.
You say that. I'm glad you say that.
You have to say that. Because
right.
the baby, you can't not feed the baby.
I tell parents all the time that are nervous because they're not enjoying breastfeeding. Maybe they're depressed or they don't like it and they don't want to do it. My mom never breastfed me. She knew right from the get-go she needed her sleep. She's just the type of person it wasn't her.
Yeah.
It wasn't for her.
Yeah.
And I tell people I'm still here. Still here to tell the story. So I think there's a balance as a pediatrician. You want to make sure you support moms if they want to breastfeed, but not make them feel bad about it if they're not interested.
No, I do whatever I can within my power to help a mom who wants to breastfeed.
Yes.
Because that's what I do. And if someone said to me,
that is what you do.
That's what I do. But if someone said, I don't want to do this, then you know what? Don't do it. I'm the first one to say, don't do it, because you're going to dread it and you're not going to feel good about it. And you're not going to feel good about the baby or yourself. And it's not worth that mental health. It's better. Right. You should love the baby, nourish the baby, feed the baby, and so be it. I was formula fed. Look at me. I mean, I could have been a surgeon, but okay, fine.
Like your son.
Yeah.
No, it's nice to hear you say that, because I also think the more moms feel comfortable talking about it, the better off everybody is.
If they're in a climate of openness and they know that they're not going to be castigated for saying the F word, then formula. I've said that to them before. You can say the F word to me. It's okay. I'll still be your friend. because then you have open communication. You establish trust. And right. Then you can help them do what they want to do. This is not my baby. This is their baby. And if right. they feel good about their baby, then I feel good about what they're doing.
Right.
And I'd much rather have a mixed feed if the baby was half formula, half breast milk, than no breast milk at all.
I agree. So it's interesting because in my mind, I'm very goal oriented, and I know that the recommendation was to try to breastfeed till a year. So I never said it out loud because a year sounded really daunting, but that was really how long I wanted to breastfeed for. But then I ended up breastfeeding beyond a year because I liked it. I actually, in the beginning, there's a lot of pressure with breastfeeding, how frequently it is, and you have to do it throughout the night. But then once we got beyond a year, it was, it was more before bedtime when they woke up in the morning, and it was nice time, especially I think as a working mom. I had something to look forward to that was just our time together, some bonding time.
Yes.
So, I actually ended up breastfeeding well beyond a year with all three of my kids. One could even after two, to be honest.
That's fabulous. That is absolutely fabulous. And I hear that a lot from moms who are working, that
yes.
they don't want to wean because especially it's their time to sit down, put their feet up, and I'm not doing anything right now. I'm going to feed the baby.
Yes.
And babies look forward to that. They know.
Yes.
It's good for you.
Yeah. So for me, for my life, I enjoyed it, but I also feel like for a lot of moms that aren't interested, I completely understand, because I've been there. I've experienced the pain and the discomfort and the sleepless nights, and especially in those beginning weeks. I find though, if I can encourage moms to make it past 6 weeks, that seems to be a sweet spot.
Yeah. It is, and 8 weeks is magic. I've been known to tell them that. I say 8 weeks is absolutely magical. You'll look back and say, was it ever hard? But you've got to get past the first 8 weeks. 8 weeks. And then
it's
all
funny
of a sudden,
it gets better. No, it's funny you say that, because I remember being in such pain nursing in the early weeks, and I'd see other moms they'd tell me they were sleeping while they were breastfeeding. Like they were so relaxed, they could sleep and nurse at the same time. And I thought, how could they be in so little discomfort that they could get, that they could be that comfortable, they could sleep and breastfeed. And then you're right, after about 6 to 8 weeks, I saw how that was possible.
Yeah, magic. All of a sudden, the magic breast fairy appeared and everything got easier, and the baby learned what they're doing and you understood what you're doing. And it's like a dance, you go take ballroom dancing. And in the beginning, at least for Rob and I, we stepped on each other's feet, and he goes left, I go right. We couldn't do it. But after a while, you go through a couple of classes together, and it's kind of like, I got this.
Right.
So it's the same thing. It's a dance. It's a finely tuned dance that a mom and a baby does together, that they have to learn each other and learn about each other.
One thing I so appreciate about lactation consultants is that you're great to refer patients to, because sometimes moms are discouraged in the early days, in the first few days of having a child, and they want to go right to formula. And sometimes if I can encourage them to see a lactation consultant before they go right to formula, it makes all the difference. You can offer the tips and the tricks to get them through that tough period.
But again, it's that thing when someone says to you, you can't feed your baby, and you've got the breasts and you have the desire, but you can't.
Right.
Really tell me I can't? Okay.
Right.
I'll have to make up for that the rest of my life.
And and I feel like, when you have a baby, all you want to do is feed your baby. It's biology, right? Like all you want to do is see your child
do well,
grow and thrive and do well.
And nourish. Yeah. Right. And the worst thing for a new mom is for someone to say, you can't do this. And her whole being wants to do it. So if the mom says, I don't want to do it, I respect it. But if she wants to do it, darn it, she's going to do it.
Right.
She wants it.
Right.
It is biology. It's the way we're set. We're wired that way.
Thank you so much for all these tips. I really appreciate it.
I hope it's a little helpful.
Very helpful. Oh my goodness. I think there's so many questions. And I know for myself, when I had my first child especially, I was so nervous because I wanted to be a successful breastfeeder. And I wasn't sure if it was going to work. How do you know until you have a child? So.
Well, I admire you. You did it. I knew you were going to do it. And it can be done. You just have to want to do it. This is like we said. It's normal.
I do think it takes a village. I really think what helped me was asking a lot of advice from different people. Mm-hmm. It takes a village.
It does. And then be sure that whoever you're speaking with is giving you accurate advice, not something that they read in a book written by someone who wouldn't really know.
That's good advice as well. Is there anything else that you want to add? Any other, no pressure on this, but any other tips that we didn't cover that you think would be helpful to new moms that are thinking about breastfeeding?
I guess if you're not sure of anything, get help. You can't overfeed the baby, so feed the baby a lot. count the diapers, and trust that your body knows what to do. It really does know what to do. And today in our society, we don't often see people who live next door to us, let alone back in times before. We all lived in a little village. Everybody breastfed. You saw it. You grew up with it. You never questioned it. It's just what you did. And now there's a lot of controversy. Do I feed? Do I not feed? How long do I feed? How long is the feeding? There's so many questions. You can't access a nursing mom necessarily unless you're in a support group, a chat group, or you have a good friend who knows someone who's nursing and you're around them.
Right.
You surround yourself with people, like we said early on. Get a pediatrician, I have to say it, like you, who understands the process, who's been there, who can say, I'll guide you. You're doing well. You can do this. Because it means so much to the parent, to the mom.
And get that positive support.
Yeah. Yeah. And from her significant other too, from her partner. That person has to be on board with this is the decision we're doing. And that person has to be helpful to her. It makes a difference.
Makes a big difference. I agree. Yeah. Thank you so much for all of your advice and expertise. I really appreciate it. And I hope it helps. I know it will be helpful to a lot of parents out there.
I hope so. I'm here for you.
Thank you so much. Thank you.
Thank you. My pleasure.